Hi class, my name is Brittany Anderson, and today I will be discussing with you a topic referred to as generalized anxiety disorder. As we know, millions of people in our world today have a hard time completing many daily life tasks without a constant worry or anxiety about doing them. The worrying takes over one's life and puts limitations on the tasks they need to accomplish. This is a disorder that we refer to as generalized anxiety disorder. Generalized anxiety disorder is classified as worrying that affects and takes over one's daily life. In researching this topic, as well as with my degree in psychology, I have learned how generalized anxiety disorder affects people and their lives every day. Today, I will discuss with you the causes, treatment, diagnostic criteria, and symptoms of generalized anxiety disorder. Let's start by taking a look at the causes of this disorder. There have not yet been any exact causes linked to generalized anxiety disorder, but in my studies, according to Edward Craighead, there have been several factors shown to influence it. Some of these factors include brain chemicals, which we also know as neurotransmitters, for example, serotonin or dopamine or norepinephrine, can cause generalized anxiety disorder. Genetics, one's life experiences, stress, or stressors, for example, if one's in school, maybe school, can also cause generalized anxiety disorder. There are several health problems, as you might expect, that can cause generalized anxiety disorder. These include heart problems of all sort, really, thyroid problems, either hypothyroidism or hyperthyroidism, either an underactive or an overactive thyroid, and reflux disease, which is often seen as acid reflux. Now let's take a look at the symptoms of generalized anxiety disorder. The main symptom is common with all people that suffer this disorder. The main symptom is an excessive worry about basically everything in one's life, a constant worrying. People with this often find themselves worrying about things that they end up saying, why did I even worry about that? The worrying can become so excessive that it can be seen to cause an obsession. Physical symptoms of generalized anxiety disorder include fatigue. One may have problems sleeping, such as either not being able to sleep, sleeping too much, or waking up often throughout the night. One may have trembling, and also sometimes muscle tension is a symptom seen in patients with generalized anxiety disorder. Other symptoms that can occur include one being blank-minded, which basically means you have a hard time figuring out what to say when put on the spot or asked something. One may have irritability or even a feeling of being revved up or energized. Now I will discuss with you the diagnostic criteria for generalized anxiety disorder, which people can often turn to the DSM-V, which is a book that psychiatrists use or psychologists when trying to diagnose someone. The main diagnostic criteria that they will tell you is an excessive anxiety or worry about several events or actions that occurs most days of the week for at least 6 months. Another diagnostic criteria of generalized anxiety disorder is if the worrying affects one's daily life so much to the point where they have a hard time just functioning or getting normal tasks done. If one also has a hard time controlling their feelings, maybe they're highly emotional or can't show any emotion, just to name an example, those are also signs that require treatment for generalized anxiety disorder. At least 3 of the following I'm about to tell you in adults and 1 of the following in children need to be present in order for one to be diagnosed with this disorder, such as restlessness, fatigue, irritability, a trouble concentrating, muscle tension, or several sleep problems. Lastly, generalized anxiety disorder is often seen in combination with another mental health disorder. For example, one may have a mental health disorder such as depression, which is definitely the most common disorder seen to go hand in hand with generalized anxiety disorder. One may also have panic disorder or phobias. For example, from what I had learned, a phobia could be a fear of snakes. Someone can't be in the same room as a snake or else they freak out. That could also go hand in hand with generalized anxiety. Next, I will discuss with you the treatment for this disorder. According to the Mayo Clinic, which is where I got some of my information during studying this, The two main treatment options for generalized anxiety disorder are either medication or psychotherapy. However, from what I have studied, usually, and from my own personal experience, usually the two hand in hand, psychotherapy and medication, work best for the treatment. For using my prop, this is a medication bottle from your local pharmacy. That is usually what you will see as the bottle that your medication will come in if you are being treated with an antipsychotic or anti-anxiety drug. That's often what it will come in, and your doctor will have to prescribe that for you. The three main types of medication that you might receive are either antidepressants, benzodiazepines, or bupropion. And a psychiatrist will have to make this determination based on analyzing you, meeting with you, and trying to figure out if you meet the criteria for generalized anxiety disorder. Psychotherapy, which I discussed also goes hand in hand with medication, is often called cognitive-based therapy, it's also known as talk therapy, which involves talking with a psychiatrist and the individual, trying to figure out what stressors are causing their anxiety and ways to cope with it. Cognitive-based therapy, however, has been shown to be the best effective method. It teaches one how to deal and cope with the struggles they face in life and tries to find the reason as to why it is bothering them. In conclusion, after learning about generalized anxiety disorder, we see how important it is to get treatment if we feel we have any of the symptoms I have discussed. Today I focused on the main aspects of this disorder to help my audience understand the causes of generalized anxiety disorder, the symptoms, the treatment, and the diagnostic criteria of this disorder. As we have learned from my speech today, people often benefit most from psychotherapy, cognitive-based talk therapy, and medication to best treat this disorder. Today, in my speech, I used the sources that were, one was a book called Psychopathology, written by Edward Craighead, which discusses the diagnostic criteria, the history of generalized anxiety disorder, and the treatment. I also used the Mayo Clinic, which is a website you can go to refer to some information on this disorder. If any of you have any questions on generalized anxiety disorder, or if you just wanted to contact me about it, feel free to email me or anything. I've done a lot of study on this and as well as other mental health disorders, and I would have no problem helping anybody. Thank you, and I hope you guys enjoyed it.